Good morning. As you all know, I am Dr. Mahesh Kumar, the Medical Director of Hamsa Renal Care Seychelles. Today we are going to talk about kidney disease in children. It's an interesting topic and something which is close to me. The first thing is kidney disease common in children? Yes, it does happen in children. Children also get affected with kidneys, but there's a difference when we talk about kidney disease in adults and kidney disease in children. Kidney disease in children most of the time is recoverable. It's not like they are going to have a permanent kidney damage and they're going to suffer lifelong. There are some diseases which affect on the long term, but most of the diseases which commonly affect the kidneys in children do recover completely. Now, what are the types of diseases that affect kidneys in children? One, the major chunk, it also depends on the age group, to be honest. The major chunk in the newborn period and during the first and second year of life is something known as congenital anomalies of the kidney and urinary tract. These diseases could be hereditary or acquired. By this I mean something which is genetic, which is passed on through generations in the family, that could affect the kidneys and that would cause a kidney problem in children. Or acquired during pregnancy. The mother is pregnant, unknowingly she takes some medicines which are not safe for the baby. These are the teratogenic drugs, could be ACE inhibitors which usually take for hypertension, or some recreational drugs or smoking, alcohol. These can all affect the kidneys of the unborn child in the mother's womb. These diseases constitute a major chunk in the first year of life. Now coming to the younger age group. In the younger age group, the diseases predominantly are the glomerular nephritis and acute kidney injury. Among the glomerular nephritis, major chunk is minimal change disease. That means it's a nephrotic syndrome. Presentation will be like swelling of the face, hands, legs. The baby looks bloated. The urine shows lot of protein excretion in the urine. In this condition, usually we start treatment without much of a further investigation in terms of biopsy. In adults, we do a biopsy. In children, most of the time, treatment is started because it is most of the time recoverable. With a complete course of steroid therapy that is given for the child, the kidney disease, the proteinuria resolves and the baby usually recovers within a matter of 4 weeks to 8 weeks of treatment. Now, the other aspect is the renal failure. Renal failure, yes, in kidney failure in children, it does occur. The major issue is as a complication of gastroenteritis. When the child develops diarrheal disease, it can lose lot of liquids and that can also affect the kidneys. And this usually recovers completely. It will again take 4 to 8 weeks of time for the complete recovery of all the renal functions for the child. The other aspect is, as we discussed, is the cystic diseases. Children can also develop cysts in the kidneys. This is hereditary, again passed on from generation to generation. Most of the time it develops later on in the life, but some diseases do develop in early childhood. This requires continuous monitoring and follow-up of the patient. Not much of a therapeutic aspect is available for these conditions. Now, what do we do in cases of treatment of these patients? In cases of CACUT, that is congenital anomalies of kidney and urinary tract, the presentation is basically in terms of renal failure. There is an obstruction. When there is an obstruction to the urine flow, the kidney function is hampered. So the objective of treatment will be only to relieve this obstruction. This obstruction could be because of a stenosis or a reflex, non-obstructing reflexing nephropathy. These nephropathies do require follow-up and some sort of surgery to correct the pathology underlying. The other form, that is nephrotic syndrome, the treatment aspect is mainly conservative in terms of medicines. Steroid is the mainstay for that. Infections do cause, so we have to treat the infection in patients with renal failure caused by infection. And lastly, in renal failure, secondary to gastroenteritis or an infection, underlying etiology needs to be treated. That means if there is an infection, treat the infection. If there is dehydration that is causing the renal failure, correct the hydration status of the child. That will help the patients recover their kidney function. So in summary, as we discussed, kidney diseases in children do occur. It is common. Most of the time it recovers by itself, especially the terms of renal failure. When we talk about correcting dehydration, it just recovers. The treatment options are available for children with nephrotic syndrome and glomerulonephritis. Some congenital anomalies can be treated with surgery, and some of them do not require surgery, in the sense, for example, there is a condition known as multicystic dysplastic kidney of the kidney, multicystic dysplastic kidney disease. The kidneys are changed into cystic sacs. So this condition requires only observation, because these are non-functional, do not cause any harm, especially for the child. And as they grow, as the child grows, these mass resolve by themselves. And in adults, sometimes when you do a scan, they'll say they have only born with one kidney, but they actually born with two kidneys. One kidney disappears because they get resolved. So this is what it is as an outlook. The outlook of kidney disease in children, they do occur. Most of them recover with treatment. The key to it is keen observation. When they have a kidney problem, consult your physician, and they can assist you in guiding what to do with these kind of problems. Thank you.